we're gonna start first with an introduction of our team, and we will show a couple of videos about different TMS devices we have and how we simply demonstrate how to set up a patient and start a treatment. First, I will start with Celie. She's one of our treaters. Say hi.
Hi.
Teresa, and we talked, obviously, you had a few talks from Teresa about how to run a TMS practice and what is the biggest challenge she had before. So she's one of the coordinator, of course. We have Erin. Hi.
Hi.
And we have Rachel, one of the treater as well.
Yes.
And in our workshop, she actually worked as a demos patient and volunteer. So thank you, and we'll take you guys to the TMS rooms for demonstration. Okay, so this is the clinical part where we're going to show or demonstrate each TMS device we have. So the first device is called manufactured by Neurostar, which is the American company. And as you see here, the device is actually made from the chair where the patient will receive his treatment, the head support, and the most important is TMS coil. And this coil is producing 1.5 Tesla of energy, and that's what we discussed over the slides we show. And when eventually after COVID, we're able to have like a live demo where we can have the clinicians and psychiatrists will be trained on the device. And now we can have Erin to show us, is our obviously one of the treaters we introduced early on, how to set up a patient before we start the treatment. Erin, you can take it from there.
For a motor threshold determination, we'll start with the chair zeroed out. So all of the different parts, the head rest and the LLC will be at 0, and we will determine those locations depending on the patient's comfort.
Can you show us the LLC again? So this is the head support information.
The head rest goes forward and back, up and down.
And why this is important again? So the patient can't actually move, and this has to be exactly the same every single treatment. After this, what we do next?
Next, we'll put on the protective barriers. One covering goes over the coil itself. One over the headrest. And one on the side head pad. The strap will be placed across the patient's forehead.
Okay. And now the next will be taking the patient information from the system and having our demo patients. Here's our demo patient. Rachel is one of our team. So Erin will demonstrate how to set up the patient on a chair and how to get ready for the first treatment. Erin?
Now that we have the patient in the chair, I will locate that patient's profile on this display after having added it through the TrackStar system, which is Neurostar's system for its patients. I will confirm the patient's name and date of birth. And once I've done that, I will click on patient positioning. The patient positioning is what will allow me to make sure that the patient is in the same location each time she comes in for treatment. It is helpful to choose a location in the room where the machine is and designate that mark for the patient to center themselves. Next, I will place the strap across the patient's forehead while she is seated. Can you please turn and face towards me? You will align the strap along the bridge of her nose. All right, you can go ahead and turn around. Once she's seated herself in the chair again, I'll confirm whether or not she has any metal implants in her head or neck region, any medication changes, any other medical history that I should know about, and whether or not she needs to use the restroom. I will then recline the chair by using the M2 button on the remote. Once the patient is fully reclined, we can begin positioning the headrest. The patient will be in the same position on a daily basis when she comes in for her treatment, so it's important that the patient is comfortable, as she will need to be in the same position each time. Any deviations to the position will require a new motor threshold determination. Go ahead and lean your head back. I'm going to move the headrest forward and back, and you tell me which is more comfortable.
Okay.
This is forward.
Okay.
This is backward.
Right about there.
I will now move the headrest up and down. Up. Down.
Right there.
And it is important to make sure that the patient's head is cradled within the headrest. And you can do that by checking around the patient's head. Once those are measured, you'll place the measurements in the system. And next, look for the LLC measurement. To determine the LLC measurement, it is helpful to dim the lights, to use the laser on the AP bar. So after turning the laser on the AP bar on, I will look for the laser to match up with the crease of the patient's eye. And I will do that by adjusting the LLC knob on the back of the headrest. Once the laser is at the corner of her eye, that is where I will position the LLC. Next, I will position the AP bar so that it is centered on the strip here. It is helpful to fold the tip up so that the laser beam catches and it is easier to see. I will lightly place the Velcro sides on the headrest. While I continue to center the patient using the side headrest. With the laser beam still on, I'll engage the side headrest by pressing it against the patient's head. I like to use my other hand for support to keep the patient's head centered while doing so. Move your head slightly. Now the patient's head is centered. The provider will come in next for his motor threshold determination, where he will place the coil on the patient's head.
Thank you, Erin, for positioning the patient. So as Erin actually have the patient ready, and we pretty much can start determine the location, as we talked about how important to find exact location for placing this coil to start the treatment, right? So first, obviously, we're going to put the arm support. So let's make the patient comfortable. We have 3 parameters that we need to determine, and we're going to feed to the system the SOA, which basically, if you could come with the camera, this go from range from 0 all the way to 45, and a few times we have to go even below that. That's the SOA. Then we have an AP, goes forward and backward, so from 0 to 22. And then we have the coil angle, could be negative, or could be positive. So basically, those are the 3 dimensions that it will determine the location of the coil based on the motor strip. While I'm trying to locate the best treatment location, Aaron will hold this form that is actually come and made to determine where exactly the best stimulus and how accurate it is. Because as we talked about, we try to find the most close location that stimulate the thumb, which we know it is 5.5 centimeter backward, or the dorsolateral prefrontal cortex will be 5.5 centimeter ahead of this location. So first, we start with like 30. So you can start writing this down. So 30, 7, and angle is 0. Okay. So this is the first location that you will put it in. And use up to 5. And angle is 0. Okay. So now I ask my patient to lift up. Okay, and we start to look for arm movement. So the pulse will be, this is how you change the pulse intensity. So it's like this. This is how it feels like. So let's just pause here. Rachel, how does it feel like?
It feels like a light tap.
Light tap. So this is basically how the first treatment location, localizing the MT, feels like. It's a little bit like, almost like a tap. So there's this screen showing the contact of the coil, and this is something, it's useful to see the contact actually, obviously. Be positive, you see these 2 green dots. So we start to move up until we start to see movement. Comes up. Okay. So obviously the hand movements disappeared. Okay. It's a little bit there. But obviously Aaron will record either positive or negative. So the first one will be like our standard. Then if you move forward until completely the movement goes away. And I go another, so again, it was 5, 6, and 7. So now it's 5.5. I go start again. So at this point, I see there's no movement. So I could go back again with the AP, just with the coil. And again, I go, as you can see, I move forward or backward with the coil, hunting for what is the best location that start the movements, right? And the strongest movement will be the area where I'm actually going to focus on. And then, so I move backward to, now it is 4. So it was started 5, my baseline was 5. I went to 6 and 7, and now I move back to 4. And obviously, again, maintaining the contact has to be all the time. There's contact there, and we'll see if there's any movement or not. So again, there's not much movement. So it means that 5, pretty much the best location for it, right? And obviously, make sure there's a contact. Now, if you go the next movement, so now we know the best AP, which is in this case, according to this, actually 5.4 to be specific. And again, the next step will be going upward and backward to isolate a thumb if we can. Sometimes we can't, and we do our best estimate. Then you see the movements very strong. Then I ask the patient maybe like rest your hand a little bit and almost like dry your hand. Or maybe you could use distraction. You can talk to your patients. You don't, because if you don't have like a very intense situation, so you talk to your patient, you could maybe ask about their day. And that's one of the tips you can use to avoid having the patient very tense. So most important, have the patient loose a little bit, not able to think, which is hard. So you try have the patient relax and not thinking about their pulses, so to become more easy and reflex, right? So after determine right and left, you can see the clear movement in the middle finger and ring finger here. But we try to get close to the thumb. Okay.
Next, I'll place the wedge cushion under the patient's arm.
So now to determine the intensity. So what we do now, so we find the location. So how much energy to provide to determine the treatment. So we first found the location. So the machine has a series of pulses going to deliver to determine how much we could treat. So you see any movement, so we have yes or no, and we say, for example, no here. Then we're gonna have like a stronger stimulus. Yes. So you can see movement, so it's yes. So every 10 seconds. I didn't see movement here.
Yes.
Did you see it here? Okay, good. So as you see, so the dosage, obviously, if you keep going, is gonna be fine adjustment, no, or yes, I didn't see. So until the MT level will be, for example, 1.08 in her case. I think, yes, I saw that too. So, for example, if we have series of no's, like she did not move and the energy was too low, then this could be go down or up. As we talked about, those actually are the parameters to determine the least amount of energy. Yes or no? We could actually, even if you didn't see it, you could let it run another cycle to see if there's a movement or not. Yes. Okay. So keep going until we obviously say save the MT. I will say obviously you have to keep the whole sequence of pulses to determine the location. So yes. And that's a good thing to have like another set of eyes in the room. See, I think, no. And you could see the power. There are like 4 sets to determine. Again, this is unique for NeuroStar device. So as you see, the MT went down to 1.04, which basically this is how they determine energy.
Yes.
Okay. So as you see here, so it becomes 0.99. That's exactly how much level need to be. So the energy needed to move the thumb, it is not equal to the energy needed to deliver the treatment. It's 120% of this. So when we say save MT, first of all, the machine will determine, okay, we have to move 5.5 centimeter from the location of this, right? And it's going to be 10.9. And so this is exactly the location to treat. As you see, we have the 2 points of contact, exactly the location moved, and the machine will save this information for every single time we deliver the treatment. Okay, and then you say, okay, once the machine determines the location and the energy, which is going to be 120% of this NT, then we start the treatment. Obviously, we're looking for any eye twitches, if there is any, and make sure the location is okay, patient is comfortable. It's okay to start in the first few sessions with less than 120%. That could go down to maybe 100%. Just patient gets used to the treatment, and then slowly the treater will try to get it up to 120%. And since patient doesn't want to have free treatment today, I will just move it up a little bit here and just show it to how it actually sounds like. So this is actually this amount of pulses. It's happening in 4 seconds. We have 10 pulses per second for 4 seconds. We have 40 pulses that actually counted. Okay, and then this, of course, alarm, there's no contact. So that's another thing we have to make sure it is. So we'll stop the treatment now, and we obviously have further things to talk about with the machine. Each machine is different, and obviously we have different parameters. We talked about we have a right side treatment, and we have now actually NeuroStar have theta burst, which is like condensed treatment that you could do treatment in 3 minutes. So more treatments, options, and obviously more training. Hopefully will coming soon once we are open up for a live situation. We don't have to have, you're still going to have masks, but hopefully in the near future we could have a live demo and training for our colleagues. Thank you. Now we have the night venture device. This is another device to treat patients with depression. We use it along with the other device, NeuroStar. We're just going to walk through how set up the patient with Celie and how she will have the patient ready. As you know, the same principle. We have a coil, and you have the machine generating the energy, and obviously we have this chair, and we have to basically same principle with stabilizing the patients. So Celie, you can take over from here.
So this chair here has different adjustments, so we want to make sure that the patient is sitting in a neutral setting, so it goes backwards and forwards, so all the way up. It also has a footrest area, so it can go all the way up to make the patient comfortable during treatments. However, like I said, we want to keep it at a neutral position when we're rooming them. There's a vacuum pillow on the back of this, so we want to make sure that it has the pillowcase on it, and then the coil will just stay back here. Before we bring the patient in, we can search the patient on this tablet here that connects to our cloud system, and then we will select the patient, and their treatment will come up, and we can confirm that it's the correct treatment. So to begin, we will want to have the patient in a relaxed position, so you can move the chair up. Then we will take some measurements to get the proper cap size.
So in this chair, we use a cap.
So first, I'm going to measure the circumference of the patient's head. So I'm going to have Rachel help me here. Right there. And we are measuring in centimeters. So we'll go right around here. And that's looking at about 56.5 centimeters.
Okay.
From there, we will document that. And then we will look to see the sizing for the caps, which we have. I'm going to try the small cap for her. For these caps, we want them to have a snug fit and not have any excess material. So it's a lot like a swimmer's cap or a flimsy baseball cap. And it secures in the back with Velcro. So that's a good fit right there, and we want to make sure that it is centered on the patient. The next measurement that we're going to take is going from the nasion, which is that innermost dent part of the nose. Rachel, I'm going to have you hold that. To the inion, which is the dent in the back of the head. You kind of lean forward for me. And sometimes it's a little tricky to find. 41 centimeters right there.
You could hold it.
The next measurement that we're going to do is from tragus to tragus.
So basically, when you do the tragus to tragus, has to crawl across this point. Okay.
After we get the measurements of the cap, we will then mark a triangle going 5 centimeters towards her tragus. And then 5 centimeters towards the front of the cap.
So basically, this triangle is a location that most likely you will find your MT.
We also want to make sure we're marking where the ears are on the cap.
So it doesn't move.
And additionally marking the midpoint of the cap.
Excellent. So there's another method for finding the motor threshold. Can you talk us a little bit about this other method?
Yep, so this other method that we have is called the modified beam method. We use a special system in the computer to help us determine what measurements we need. So we need to enter the distance of tragus to tragus, which was 39 centimeters. Then we enter the distance of nasion to inion, which was 41 centimeters. Then we enter the circumference, which was 56.5, and we push calculate.
Okay.
We'll then mark on the patient's cap following these measurements. So to begin, we want to mark out 6.55 centimeters out from the midpoint here on an x-axis. There. And next, we will want to go down at an angle 10.58 from the midpoint towards that X point that we made there. So here's the midpoint. To line it up. Eight, which comes out to around there, and we'll mark it with an X.
So basically, this method is just to confirm after you do your MT where most likely you could find the treatment location. So these two different methods should be advised to use same time to make sure that your measurements and your treatments are matching each other. So once you do with like the traditional method that you were trained by the representative from McVenture, how you do, because they do basically the triangular method, and we're going to show the coil, how the coil actually designed to the MT coil of the McVenture is different from the treatment coil, and we're going to show this right now in the video. So we start again in this device. It's different as it has two different coils. This is called the B60 coil. This is the coil just made to determine the MT. It's different from actual treatment coil that we're going to show. So once you hook up the coil to the device, you have the enable button in the device, as you can see, and you could dial up the energy, as we talked in the other device. You could actually use it by move it from here as they connected, right? And there's also this iPad screen you don't even have to use the screen, and you just could use the screen to move up or down the MT, right? So the machine recognize the device as a B60, and we're using the right hand to determine the MT, and this is the energy we use. We cannot compare the energy output from this device and the NeuroStar device. As you remember, the MT for Rachel and the other device it was 0.99. Here, it actually has percentage. So it's not like apple to apple here. But the energy coming out at the end is the same amount of Tesla. So, or Joule. Okay. So you see here, there's a wing in the coil. So if you want to do left side, it has actually marked as a left, and you connect it. And I think Sealy has the right side wing here. I want to show it to you here. So if you want to do the right side, this wing is basically the 5.5 centimeter that you want to actually show, and the coil will move in too. Ask the patient to relax. You don't have to actually have the patient hands up or anything like this. And then you can feel the pulse like this. Again, like a tap. You start with the triangle, and you move with the energy until you start to see movements. And then you see the hands. And then you start to adjust. So once you find the location, you have this wonderful marker here and make this location here. You see the center that determined by the modified beam is basically will be the center of the coil here. And this will be the edge of the coil. So once we determine the MT intensity by the coil, then obviously the machine for Rachel is 64%. We write save MT, and the machine already determined the amount of energy, which is 77%. And then obviously we will press enable, and so the treatment once hook up the treatment coil. So as you know, there's two coils for this device. One to find out exactly the MT location, and the other one to deliver the treatment. We'll pause here, and Siri will show us how to put the head support and get the patient ready for the treatment.
All right, next we will place the vacuum pillow behind the patient's head, making sure that the neck rest is above the shoulders. So this will need to be around their neck, and then have them lean back. And make sure it's cradling their head. Then push the pedal and it will take the air out.
So this is the way to fix the head, I believe, in this device. It's actually very simple, but it's very effective. Make sure the patient unable, obviously, to move his head. He still can move his head though, right? A little bit.
A little bit. We want it to be fairly fixed though.
Okay.
So once they're positioned there, we can then move the coil onto where the patient is. Here we want to adjust it so that we're matching up where the doctor put the marking from the MT. We want to make sure that the arms are tight so that the coil does not slip.
Excellent. Obviously, after Sealy placed the coil and we have the treatment ready, obviously we can start the treatment. And in this case, we don't want to start treatment again for Rachel. For Rachel, we don't want to keep giving her treatments, but we will obviously talk about a few things. You make sure there is no any unusual movement, like eye twitching, jaw movements. Those actually are something could happen. It depends on how big is the coil and the placement, obviously. And as you could see, the treatment lasts between 15 to 20 minutes. Both machines are capable for the shorter treatment, which is a theta burst stimulation for 3 minutes. There is a few things, obviously, based on the training and hands-on. You will learn how to overcome some of the small tricks, like how could easily get the motor threshold if it is hard to get it, how you could move your coil, and how you place it. For example, one thing we learned, if there is a movement, you try to angle the coil a little bit and put your hand, you could move it up or you could move it down, and this depends on, so you could move it up like this, and you make sure you have fingers, could go underneath the coil, and that's sometimes if the patients make sure there is a contact. As you can see, there is no contact information on the screen, but at the end of the day, patients have similar results of the response in both coils. Also, if there is a jaw movement, sometimes you could actually move the coil a bit up, like tilt it up. So this small tiltation, you moving the coil, try as much as possible not to take it away from the marked location on the cap. But that is very important. Again, more precise location is important for whatever TMS device you have. I think will conclude our demo. Thank you so much. Thanks, Seely. Thanks, Erin, for holding the camera. And obviously, we'll thank Rachel for all this demo. Thank you so much. Bye, guys.